Sharen Duke has been Executive Director of the AIDS Service Center, New York City for 20 years. Now, you've called AIDS Service Center a place where people with HIV get a second chance to rebuild their lives.
Well, here at AIDS Service Center, we do pride ourselves on helping HIV-positive New Yorkers and those at risk get a second chance through our programs, which promote self-respect, personal responsibility, connection to community, and we, as an organization, seek to build community and connection for the people that we serve through our access to healthcare programs and support services, our peer education, and safe practice counseling. I am very proud to say that over the 20 years, AIDS Service Center has evolved into a multi-service, multilingual, multi-site, multi-million-dollar organization. We serve 14,000 New Yorkers each year through prevention education and direct support services. And AIDS Service Center truly does provide opportunities for people to transform their lives.
But back then, when you walked into the place, that was 5 or 6 years from the drug cocktails that have helped people live more normal lifespans. What was it like working in AIDS back then, and what did you do for your clients then?
Well, I have to say, in the early 1990s, there was a flurry of activity. There was a lot of government support for programming, and there was a lot of sadness and death. And we went to memorial services essentially on a weekly basis. With the advances in HIV treatments and access to the antiretroviral therapies, people started to live longer. And essentially, we started in the 1990s wanting to create hope in an environment where it felt hopeless because people very young were having their lives stolen from them by this disease. And through the late 90s and the early 2000s, with the treatment advances, we came to understand that people living with HIV were more than their diagnosis, more than their sexual orientation, more than their race or ethnicity, and that we needed to support the whole person. We tried to create a one-stop shop approach where folks could access whatever type of service met their specific need. And we've had clients in the waiting room who would come in every morning just for a muffin and a cup of coffee, and each day we'd say, "Would you like to meet a counselor?" And they would say, "No, not today." There was one guy who came every day for almost 2 years, and then one day he was ready and he got to see a caseworker, and that was the beginning of the change for him. We essentially work with them to get their lives in order, to take charge of their health, to take charge of their health care. And we provide the support and the nurturance. They do the hard work. And then we have this peer education and training program where not everybody, but some people decide that they want to, once they've gotten stabilized, they want to give back. And they become peer educators who take messages of the importance of HIV testing and knowing your status and getting into medical care. They take those messages out into the communities, and they are the most authentic and incredibly powerful messengers of prevention and help us really extend our reach and connect people to care.
So your peer program has had 38 graduations. Who are these people who are graduating? Who are the people who are coming to you in the first place? Can you describe them a little bit for us?
I'd say the majority of the people who are coming to us for the peer program are African American, Hispanic, and Asian men and women. Majority of whom are living with HIV, all of whom have been affected by HIV. In order to be eligible, you have to be in stable housing, you have to be connected to a medical doctor consistently, and you have to be in recovery from drugs or alcohol for at least a year. The training itself focuses on HIV epidemiology, immunology, modes of transmission and prevention, HIV impact in different populations. And at the end of this whole process, we offer a graduation ceremony. And a former graduate made a donation to the organization and purchased caps and gowns for the graduates to be able to wear at their graduation. And for many of them have GEDs and were high school dropouts. And when it's graduation day, they come with an amazing sense of pride. Their family members come, and for many, it's the first thing that they have completed, beginning to end. There's this one woman, Florence. She had been in a residential drug treatment program, and one of our peer educators, John, would go each week, and he would do an educational group with the residents through a collaboration that we had with the drug treatment program. And Florence would call the group the MetroCard group, because if you went to the group, you got a MetroCard. So she said, first I started going to the group for the MetroCard. Then I started to go to the group because I thought that what he was saying was sort of interest to me. Then I realized, hey, I could do what he's doing. And I went up to him afterwards and said, how did you become this peer educator? How are you doing this? And he said, come to the training. I graduated the training, and then he actually was hired by us as a full-time staff person who left welfare and rejoined the workforce. So he said, Florence, you can do this too. So Florence did come to AIDS Service Center. She went through our peer training program, PREP, the Peer Recovery Education Program. It's a 2-month program. She graduated. She interned with us. She then got a full-time job with the Bowery Residence Committee. And I was getting dressed one morning and watching New York 1, and I hear a familiar voice, and I hear it's Florence on the TV being interviewed for doing outreach in Grand Central to the homeless people in the winter to make sure that they get connected to care. She went from client to peer educator to full-time staff person who left welfare and rejoined the workforce.
Now, you've also been a tireless advocate for people with AIDS. What are the things that people still need to avoid HIV and to live with dignity when they have it?
Our community-based work to connect people to their doctors and to help facilitate an ongoing access to medical care, I think is a very important function. And we as a community organization have worked really hard to convince hospitals and health clinics of the value of partnering with a community group like AIDS Service Center, because we can be the difference between somebody getting to their medical appointment and somebody missing that appointment. The other piece of this answer in terms of what is it that folks need is that with the change in the environment, with the government shifting its focus towards people who are already infected, and with government shifting its resource towards a medical model of intervention, there's been a real reduction in the availability of resources for primary prevention, which is taking messages out into communities and preventing people from getting infected. So I think that we as an organization try to straddle that challenge and use the resources that we do have wisely and collaboratively. So that's why we partner with, SRO hotels, and we partner with drug treatment programs, and we partner with hospitals, because it's in these partnerships that we can maximize limited resource and really extend our reach into areas that will have an impact.
And I've also seen presentations by your poetry program, which has been going on for 10 years now?
Yes.
And you called it, at a recent reading of the poets from AIDS Service Center, a place of solace and safety. How did that come about as something that would help people living with HIV and AIDS or concerned about it?
It's actually somewhat related to the treatment advances in the late 1990s and the early 2000s. We wanted to be responsive to what we were hearing from our clients, which was they wanted something more than the same old, hi, I'm Sharen, I'm a HIV positive support group. So we wanted to challenge them emotionally, intellectually, and spiritually. And I thought creative writing would be a great opportunity. So I called my friend, Jerry Gomez-Proberg, who is herself a published poet, and I said, can you run a writers group for us? We did a focus group with a small group of clients, and some of the poets that they're interested in included Shakespeare. And folks were like, Shakespeare? And I said, do not underestimate the capacity of the people who come to us for service. And we formed the group, and it started with just 4 or 5, and it was in 2000. And at the end of 2000, we formed the group, and it's been meeting weekly for the past 10 years. We've had more than 150 poets come through the program. They've read Pablo Neruda, Maya Angelou, Langston Hughes, and it's beautiful. We self-publish a magazine called Situations, which was named by the group, and then every year in April we're invited by Barnes & Noble to be a part of National Poetry Month. So it's that, for me, the poetry workshop, I think, is a really it's a beautiful example of how people affected by HIV and AIDS have been able to find hope in hardship, and to really transform challenge into positive change. Nice. And it's just been a beautiful program.
You do have more than 20 years involved in AIDS, and I just want to ask you finally what your vision is for yourself and for the AIDS crisis going forward.
I think I, like so many others, have a vision and a hope and a prayer for a cure. Even though there have been amazing treatment advances and people are living long, productive, incredible lives, there still is no cure. And which means that we need organizations like the AIDS Service Center to make sure that people get connected to the services that they need and deserve. And we need organizations like the AIDS Service Center to make sure that messages of prevention and the importance of HIV testing and knowing your status and getting that medical care continue to be drummed into different populations, be it minority communities, be it the gay community, be it on the down low. I mean, whomever you are, for young kids who growing up in the age of AIDS, we still need to have an awareness and an explicit dialogue about how to protect yourself, prevent infection for yourself and for your loved ones. And that is my hope for the future, that we can continue to get the messages out there, that there can be research for a cure, but until there is a cure, organizations like AIDS Service Center are going to continue to pound the pavement for to fight bigotry, to fight stigma, to fight against cuts to programs, to ensure adequate resource and respectful and culturally relevant services that can help people take control of their own lives.